Hi, I am Dr. Ivy, one of the elite ICE 50 avatars, to present this course on 7 most common dental lawsuit by Berksey Insurance, a division of Berkshire Hathaway Insurance and ICE 50 dental malpractice partner. Dental malpractice is when the care received from a dentist, oral surgeon, or any other dental health provider was below the acceptable standard. Along with care that is below the acceptable standard, a personal injury or death from a procedure is grounds for a dental malpractice lawsuit. If there is no serious injury present, the case will most likely be dismissed. Proper documentation is going to be the key to your client winning a lawsuit. Important documentation: a copy of the written consent form that was signed prior to the surgery. If any other treatment happened without consent, this will push the case in the patient's favor. Record all of your patient's history with you. A treatment plan for any injuries or complications experienced. Notes are written regarding the procedure. Most common dental lawsuit 1. Extractions. Complications such as infection, severed nerves, and sinus perforation are the most common dental issues requiring a lawsuit. While hospitalization from infection is the reason for many lawsuits, unfortunately, some patients who experienced infection died as a result. In the case of severed nerves, the damage was permanent. When sinus perforation happened, the dentists failed to diagnose the patient accordingly. Because of this, they failed to refer the patient for treatment. 2. Endodontic complications. Following endodontic procedures are the second most popular cause of a dental lawsuit. Among the problems caused by endodontic procedures are instruments left in canals, nerve and sinus perforation, air embolisms, and life-threatening infections. Some of these cases resulted in death. Of the life-threatening cases, several were a result of brain abscesses. 3. Crown and bridge. The complications with crown and bridge treatments mostly consist of open margins, overhanging restorations, or poor occlusion. All of the cases of crown and bridge complications required some form of full mouth restoration. 4. Implant. Of the lawsuits related to implants, many were related to implants being lost. A treatment plan following the loss of the implants seemed to be either lacking or non-existent. There has also been one patient who has suffered from an infection as a result of the complication. As a result, they succumbed to the infection. 5. Periodontal disease. Periodontal disease is an infection of the bone and tissues of the mouth. When left untreated, periodontal disease can cause teeth to loosen and fall out, heart attack, stroke, or other cardiovascular issues. In the lawsuits surrounding the periodontal disease, the dentists failed to have routine X-rays which would identify periodontal disease. 6. Anesthesia. For most fatalities, anesthesia complications are tied to problems related to tooth extraction. Patients can die from surgery if they experience malignant hypothermia, which is a high fever that results from the anesthesia. It is the oral surgeon's job to keep an eye out for the symptoms of this condition and treat it immediately. 7. Drug reactions. The most common reason for adverse drug reactions is negligence in the dentist checking the patient's medical history. Because the dentists are unable to check the patient's medical history, they give a drug that interacts negatively with drugs the patient was already taking. Legal release. The views expressed in this article do not necessarily reflect those of ICE 50. One must consult with their legal and financial representatives for any and all legal advice.